There we are. We're live. Good afternoon, everybody. Thanks for joining us again. I know we had one this morning, and we want to thank Lauren and Dawn for such a great conversation about our office and what we did to get through the pandemic. We're still remote. We're still doing some stuff, but I feel like there's a light at the end of the tunnel for the first time in a long time. So today we're continuing with our pandemic stories. This is our first charity. BBB does accredit charities through our Wise Giving Alliance on the national level. So we're really excited to have Alyssa Rowley with Water for South Sudan, which is a charity that's based in Rochester, New York. And not a lot of people probably knew that. When I started working here, I didn't know that. So Alyssa, real quick, I just want you to talk about what you guys do at your nonprofit.
Sure. We actually provide clean water projects, so the most basic resource that any of us need to survive. So clean water through new well drilling and well rehabilitation projects. And then we also implement sanitation, so that's toilet facilities, and hygiene education. So we teach every community that receives a new or rehabbed well basic hygiene education and how to keep their well clean.
It's interesting. Neighbors of ours are having work done and they hit the water main. You don't realize how much you need water until it's gone. And I think that's, probably one of the critical things that, you teach everybody, and to make sure that all of that stuff is maintained as well, because as soon as the water went back on, we had to run it, to make sure everything was flushed out. So, it's just a really critical educational piece that you guys provide. So when the shutdown happened, you guys not only had to deal with the pandemic at a local level, you had to deal with it in South Sudan remotely. Talk about how you guys did that.
So just like here, things changed pretty rapidly, and we were for our teams in South Sudan, though we had communities waiting for water and knew that our teams were coming last year to provide them water. We had to stop our regular operating season activities just to protect our staff and the communities that we would be visiting. And right around that same time in March, when we stopped working, UNICEF actually approached our team in South Sudan and asked them to join them in implementing emergency COVID-19 hygiene awareness training, as well as delivering truly essential hygiene supplies to rural primary healthcare units or centers. So these are not anything close to even like our urgent care, which is for us just a basic, we're going to go there for some issue we have and it's not an emergency. These are oftentimes open air, outdoors. People are waiting out, just sitting there with someone waiting for their turn to see a medical professional, a nurse, someone that can support them. But these centers don't even have Tylenol. I mean, it's the most basic. So it was critical that our team jumped in and just started doing that work with UNICEF. And they were able to reach about 18,000 people with the hygiene education. And then they delivered to 25 units.
That's terrific. And it's like you said, we had the pandemic on our local level, where people were, in their homes, but we still had access to things that were essential. That's probably the most critical thing that you guys did, was making sure that you could still provide your services with very little or no interruption.
Yeah, and actually, just working in this organization and constantly having the different perspective of South Sudan and what's going on there. Life shut down here. We all have to stay home. We can't go to work or school, but we can still go to the grocery store. We can still get in our cars. We can still go to the doctor if we need to. Life shutting down in South Sudan means you don't have a refrigerator. You're not stocking up on food. You're not putting things in your freezer. You don't have a place to store your water. It's not the same. You have to still be able to function. So it was essential that our team was teaching people what COVID is and how they can prevent it. Just the social distancing piece. Customs in South Sudan is very close and hugging and shaking hands. And so teaching people you have to step back and not be so close to people. That's another thing that was a challenge. So just the whole pandemic, everything about it is different in South Sudan than it is here.
Yeah, it's like I said, you had Rochester, New York, and you had South Sudan. So it's incredible, like the way you guys were able to pivot. What types of things did you guys do that you're going to keep? A lot of people talk about, the hybrid office or things like, I'm still going to wear my mask even though we're not supposed to. What types of things, protocols that you had down there in South Sudan, are you going to keep going forward? Because it's something that just worked for you.
Yeah, I think really the biggest thing is just the education of COVID-19. Our team takes it very seriously, and they understand, obviously, the reasons for taking these precautions. The biggest challenge is PPE is not something readily available in South Sudan. You're not going to the grocery store to get a mask, or, I mean, you can certainly make a mask, but it's just not even close to the same. So many people don't have the option of wearing a mask out in the field, or communities, they don't have masks. So they're going to continue living their lives in rural villages, but our staff will continue maintaining social distance when appropriate and necessary. And for our office here, we did switch to full at-home working. We are now, most of us, back hybrid in some way, because we still have kids in school that are hybrid. So we're balancing that out. And potentially, I think that might be an option for us moving forward, and it's not going to go away, is my understanding. So we're happy.
Yeah, it's a whole different world, the world of work, and there's still parts of the world that COVID is, devastating people. It's not over as much as we want to think it is. It isn't. So, that's why, we talk about education being so critical. What types of education, in addition to the hygiene education, were you doing with the folks down there?
The biggest, so besides our regular hygiene education, they implemented the COVID-19 education. Oh, and that actually is now becoming a standard piece in our hygiene education. So forgot to mention that, but that will be now moving forward until whenever we don't need to talk about it anymore. That will be now part of the regular education. I'm trying to remember. I guess one of the other hygiene trainings that we've done that was different is we also trained medical professionals at the units, because they needed, it was more of a refresher course. It wasn't just in preventative, care and making sure that patients aren't close together and transmitting anything to each other. But yeah, I think that's it. I don't know if I answered the question fully, but
it's stuff that, again, we still have to remember. Keeping the distance, making sure you're still washing your hands. Even people in upstate New York need to remember these things. So that's why it's so important. Any parting thoughts going forward?
I'll just add just that piece about, thinking global, or thinking globally and acting locally. So it's something that we've talked a lot about lately. And so, yeah, locally, we have talked more about washing our hands more frequently and for longer lengths of time, and soap and sanitizing. In South Sudan, that's like new information for many people. So, and not even is it just new information, but they many times don't have the access to water to clean their hands. So we're talking about a place in the world where people just like you and me might not work in an office, obviously, but they are people just like you and me with dreams and plans and families and goals and things that they want for themselves and their communities. And providing people in South Sudan with the most basic thing that we all need to survive has, in a way, been come to the forefront for people in this past year. And I think more people have truly understood what that need for water is. And I think that's just a beautiful silver lining from this whole major ordeal, in some ways a trauma to people, is that we all have this one thing that we're connected to that we cannot deny. And that is, we all survive on water. And how can we not want everyone to have it?
Yeah. You don't even realize it until you don't have it. Or that, you take it for granted. So that's wonderful, wonderful parting thoughts. Thank you so much, Alyssa, for taking time out today.
Oh, it's so
no
nice
problem.
To meet you.
Yeah. And just a reminder, we reached out to all of our accredited businesses and charities and asked them, hey, tell us your story. Tomorrow at noon, we're going to be talking with the West Seneca Chamber of Commerce, who's one of our community partners, about how the chamber pivoted and was able to still provide services to their members and innovate during the pandemic. So Alyssa, again, thank you so much. We'll see you guys tomorrow at noon on our Facebook page. Have a great day.